Hello guys, welcome back to my YouTube channel Rahul GPAT Academy. So in last video we have discussed regarding general pharmacology as well as parasympathetic nervous system. Okay, what are the most important topics from where you can get like question in your exam PGCET exam. So that much I have covered till now in pharmacology point of view. So today I am going to discuss regarding one more important topic like sympathetic nervous system. Okay, as well as drug used in the treatment of glaucoma, as well as drug used in the treatment of gastric ulcer, as well as autocoid, one of the most important topic from where one question will be come must 100% guaranteed. Actually, in each and every exam like GPAT, NIPAR, what is the competitive exam there? One question should be there from autocoids. Okay, so this much we will discuss in this video. Actually, due to time constraint, I am unable to complete uh, complete the pharmacology portion. So on my video, I need to complete the pharmacology. Then I'll go for organic chemistry as well as pharmacognosy, few important topics from where you get maximum number of questions. So I am requesting you guys, please go through or watch the video totally till the end so that you guys will be beneficial. Okay, if you don't want to subscribe my YouTube channel, then it's okay, don't subscribe. I am not requesting to subscribe my YouTube channel, but please go through or like watch the video till the end so that you will be beneficial. That's my motto. Students should be beneficial. That's my personal motto. Okay, that's it. So let's we can start now. So first, adrenergic system or sympathetic nervous system. Whatever we have discussed regarding parasympathetic nervous system, sympathetic nervous system will be just opposite. Okay, sympathetic means like kindness, and kindness will be from our heart only. So in case of heart, sympathetic nervous system will stimulate, will show the stimulate activity. Okay now, so kindness means related to heart. Okay, so sympathetic nervous system will show the stimulation activity in case of heart. Means in case heart, in the heart, sympathetic nervous system will improve or increase each and every activity like positive nomotropic activity, positive inotropic, as well as positive like each and everything. Heart rate also will be increased. That's the main funda of sympathetic nervous system. In other cases, sympathetic nervous system will like just reduces the activity. That's it. That's the major difference between sympathetic and parasympathetic nervous system. And sympathetic nervous system, main the main chemicals nothing but the catecholamines. Those catecholamines is divided into three types mainly. Okay, that must not necessary for you guys. Though I will tell like catecholamine, non-catecholamine, as well as non-selective drug or other substances. Okay, so under catecholamines, what are the adrenaline, noradrenaline, dopamine, or dopamine. In case of non-catecholamine, dopamine as well as isoprenylene. Okay, and in case of other substances like phenylephrine, epinephrine, norepinephrine, phenylephrine, epinephrine, pseudoephedrine. Okay, these are the things are there. So no need to remember this much. So now we have to know different types of receptors are there in case of sympathetic nervous system. Before that, you guys can know the precursor amino acid, precursor amino acid of adrenaline or noradrenaline. That is about the tryptophan, sorry, tyrosine. Okay, tyrosine. That's the precursor molecule. Before that, tyrosine will be synthesized from the phenylalanine. That's it. Okay, so you need to know what is the precursor molecule in case of in the synthesis of adrenaline or noradrenaline. That's the tyrosine. Tyrosine to dopa to dopamine, dopamine to adrenaline, noradrenaline to adrenaline. Okay, that's the matter. And these chemicals will be degraded by the help of MAO MAO enzyme as well as CO catechol O methyl transferase. These two enzymes are responsible for the degradation of these catecholamines or chemicals. Okay, that's it. So now we have to discuss regarding what the most important topics or most important point you have to remember this table. Okay, it will be very very important for you guys. I have summarized all the things in this one table: receptor, its location, selective agonist, selective antagonist. Okay, all the things I have discussed here. So in case of sympathetic nervous system, mainly two types of receptor are responsible or participating or working. What are they? Alpha and beta. Alpha receptor, beta receptor. Alpha receptor is a two type, alpha 1 and alpha 2. Alpha 1 also again divided into two types, alpha 1A and alpha 1 BT. I'm not going to like in depth. No need to remember all the things, nonsense things, because in PGCET like superficial is more important. Okay, no need to remember each and everything in depth. Okay, because last time also I saw the question paper, so it's very easy question will be there. You need to just remember this much. I think it will be more than enough. So what is the location of alpha 1? Alpha 1 in eye as well as blood vessel, and alpha 2 in brain and blood vessel. Okay, so in blood vessel, alpha 1, alpha 2 as well as beta 2 will be there. Okay, in blood vessel, alpha 1, alpha 2, beta 2 will be there. Okay, so this much you have to remember. So what is the location of alpha 1? Eye and blood vessel. Alpha 2, brain, blood vessel. Okay, alpha 1 eye blood vessel, alpha 2 brain blood vessel. What is the selective agonist of alpha 1? Agonist, IN is there, wherever IN is there, that nothing but the alpha 1, like phenylephrine as well as methoxamine. Okay, PM is fast in our country. PM is the fast one. Phenylephrine as well as methoxamine. PM is the alpha 1 agonist. Alpha 1 means fast one. Who is the fast in our country? Prime Minister. Okay, that's it. PM, phenylephrine as well as methoxamine. And who is the second? CM, state level. State level CM. Clonidine as well as methyl dopa. Okay. Alpha 2 agonist, clonidine, methyl dopa, and alpha 1 agonist, phenylephrine and methoxamine. Now we have to remember antagonist. It's very easy. Alpha 1. Wherever Josin is there, Josin, okay, Josin or sin is there, those are nothing but the alpha 1 antagonist like prazosin, terazosin, all the things. And alpha 2, only one antagonist is there in alpha 2, Yombihin. Okay, Yombihin. You, me is the first person and you is the second person. So alpha 2 antagonist, Yombihin. You, okay, that's it. Now another one receptor, beta receptor. Here beta receptor again classified into beta 1, beta 2, beta 3. You have to remember the location as well as agonist and antagonist. So what the beta 1 location? Where beta 1 present? Now in beta 1, heart, heart. Okay, दिल में रहता है beta 1. Beta 1 will be in heart and daisy cell. That's it. Nothing but the kidney. And beta 2, bronchus, GIT, bladder, uterus, blood vessel, and liver. And beta 3 only adipose tissue. This one very important. Most of the time, you used to ask like what is the location of beta 1 as well as beta 3. Beta 1 heart, beta 3 adipose tissue. If adipose tissue means beta 3 will be involved in lipolysis. Lipolysis. Lipolysis means lipo means lipid and lysis means breakdown. So breakdown of lipid by the help of beta 3 receptor. Beta 3 receptor present in adipose tissue. So our glucose or glycogen will be accumulated in the form of lipid in the adipose tissue. So whenever we will be starving, the beta 3 will lead to lipolysis and you will get the energy. That's it. So in adipose tissue, beta 3 receptor is there and it will lead to lipolysis, means breakdown of lipid. That's it. So what is the beta 1 agonist, selective agonist? Dobutamine. Okay, dobutamine. Beta 1 agonist is dobutamine. Okay, dobutamine. Okay, and antagonist, Ambani. Ambani, one of the richest person, Ambani. How you have to remember? One thing you have to remember, nothing but the wherever lol is there, beta blocker means lol, laugh, out loud. Lol will be there. Okay. Wherever lol is there means it's beta blocker, and where beta blocker is okay, lol is there, beta blocker. But which one? Beta 1, beta 2, beta 3. For that one, you have to remember this one. Okay. You have to remember this one. Ambani means acetylol, ethanol, metoprolol, betoxolol, bisoprolol, as well as nebivolol and ismolol. Ammani. You just remember Ammani. Ammani, I is there. I have like replaced I with E. That's no, same only. Ammani. Okay. So A for acetylol, M for metoprolol, B for betoxolol or bisoprolol, and A for atenolol, N for nebivolol, and E for ismolol. That's it. Ammani. Wherever Ammani is there means beta 1 antagonist and beta 1 agonist dobutamine BD, 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 B1, beta 1 BD dobutamine. Okay, BD, smoking like that, BD. Okay, and beta 2 wherever for the position already I have discussed. Beta 2 agonist means salbutamol, terbutaline, formoterol, salbutamol, formoterol, all the things, torol, mol, are there. Those are nothing but the beta 2 agonist. Okay, those are nothing but the beta 2 agonist. And antagonist is betoxamine, B, beta 2, B2, B2, B2. Okay, so beta 2 or B2 antagonist is nothing but the betoxamine. Okay, beta 2 antagonist is B2 betoxamine. That's it. Okay, and beta 3, in beta 3 only one you have to remember, this nothing but the mirabegon, beta 3 agonist. That's it. So these much are more than enough from the adrenergic nervous system. Okay, these are the most important topics what you have to remember. Okay, these are the most important topics you have to. So you can like uh, you have to, you can remember the utilization or use pharmacological action of this drug also easily, because in case of um, parasympathetic nervous system, they used to increase the BP by constriction, vasoconstriction. So adrenergic system will do the vasodilation. Okay, vasodilation. So if we want to decrease the BP, then what we have to use? Na adrenergic drug, nothing but the sympathomimetic, not like sympathomimetic drug. Okay, like in alpha 2, if like alpha 2 present in brain, no? Okay, so if we want to reduce the centrally high pressure hypertension, then we have to use either methyl dopa or clonidine. This one is very important actually. Once it was it came in some most important like NEET PC or some on exam, so try to remember this one, clonidine. Okay, centrally acting antihypertensive drug is clonidine, alpha 2 agonist, clonidine. Okay, that's it. These are the things which are most important for you guys. And non-selective beta blocker. LOL is there, selective, beta 1, beta 2, all the things are there. Non-selective means TSP, timolol, sotalol, pindolol, okay, propanolol. These are the drugs which are non-selective beta blocker. Okay. After that, you have to remember regarding drug used in the treatment of glaucoma. What is glaucoma? Now, glaucoma is nothing but one type of disease where blood intraocular pressure will be more than 20 mm of Hg or 21 mm of Hg. Okay, that's it. That's the glaucoma. What is the main reason? Blood pressure pressure is increasing means production is increasing, acid, humerus production, aqueous humor production is increasing, or drainage is defected. So what is the drug we have to use? Now, the drug which reduce the secretion of aqueous humor or which improve the drainage system. That's it. Based on the different drugs are there, like aqueous secretion decrease. What the drugs are there? Beta blocker, because adrenergic system will like beta blocker you have to give because it will reduce the secretion, aqueous secretion. For the example of beta blocker, like betaxolol, levobetaxolol, timolol, cardiolol, all the drugs are there which are generally used in the treatment of glaucoma. How they will work? Now they will work by reducing the aqueous secretion. This classification I took from the a review of pharmacology by Sparsha Gupta, one of the best book for pharmacology after creating the body. You guys also can follow. Most of the things are explained very well. Next one, alpha 2 agonist. Alpha 2. Clonidine, brimonidine, apraclonidine. These are the drugs which are used in the case of glaucoma to reduce the aqueous secretion. One more important topic like carbonic anhydrase inhibitor. These are the drugs like beta blocker, alpha 2 agonist, as well as carbonic anhydrase inhibitor. Carbonic. Wherever you see like zolatamide, those are nothing but the carbonic anhydrase inhibitor. Zolatamide. Zolata, Zolatamide. Nothing but the carbonic anhydrase inhibitor. And now aqueous outflow, we need to improve the drainage system so that maximum amount of aqueous humor will be goes out, so automatically intraocular pressure will be decreased. So what are the drugs are there, like one is trabecular outflow, another one is uvuscular outflow. Okay, trabecular outflow as well as uvuscular outflow. In uvuscular outflow, what are the drugs or which type of drugs we should use? Now, prostaglandin analog. Prostra, prostaglandin analog means prost will be there. How to remember? PU, Punjab University. Okay, Punjab University. P for prostaglandin analog. U for uvuscular outflow. So, if anyone or if you will be asking question like which of the following is used in the treatment of glaucoma to improve the avascular outflow? Then you have to select like prostaglandin analog like latonprost, bimatoprost. These are the drugs. Prost, P for Prost, P for Punjab University, okay, and U for avascular outflow. That's it. And trabecular outflow, for trabecular outflow, MT, Khali, mitotic as well as alpha agonist. That's it. Or MAT you can remember like MAT. Okay, mitotic like trabecular outflow like pilocarpine as well as physostigmine and dipivibrin. So these are the drugs which are used in the treatment of glaucoma. Please try to remember this table properly. Okay, so next we are going to discuss regarding one of the most important topics, orthoquoids. Different types of substances are there, like classification if we will go for like biogenic orthoquoids are eicosanoids, peptides. Under biogenic like histamine, serotonin also known as 5-HT. Okay, 5-HT is there, and eicosanoids like prostaglandin, thromboxane as well as leukotrienes, and peptide substance P as well as bradykinin. Now these are the classification. You may get like one question or may not, but important topics. One of the important topic example of different autocoid, biogenic amines, eicosanoid, peptide, biogenic amines, histamine, serotonin, eicosanoid like prostaglandin, thromboxane, leukotrienes, peptide like substance P, bradykinin. Okay, and now we have to remember this chart. 5:1 partial agonist, partial, P for partial, P for Piron. Wherever Piron is there, 5:1 partial agonist. Okay, wherever Piron is there means partial agonist for 5:1, and agonist means at 5:1, at 5:1 agonist. A for agonist, T for triptan. Wherever triptan is there, somatriptan, naratriptan, triptan is there, are nothing but the agonist, not partial, it's agonist. P for partial, P for bisopiron. Piron is there. So 5:1 partial agonist, somatriptan, naratriptan. T is there means agonist 5:1. Okay, so triptan and piron is there means 5:1. 5:2 antagonist serine. Okay, wherever serine suffix is there, okay, as well as clozapine also are nothing but the 5:2 antagonist. And 5:3 antagonist, 5:3 antagonist means cetron will be there, cetron like ondansetron. Ondansetron, one of the drugs which are generally used in the treatment of chemotherapy induced vomiting. Okay, ondansetron. So wherever cetron is there, 5:3 antagonist should be working. And 5:4 agonist, fried. These are the drugs which are generally used as prokinetic like cisapride, cisapride, pride. Like I am proud for you. Okay, I am proud for F for 4, F for 4, F for 5:4, 5:4. Okay, F for pride for, like wherever pride is there, 5:4 agonist, 5:4 agonist example, wherever pride is there, like sister pride. That's it. Okay, and T for cetron or 3, 5:3. Okay, so these are the things you have to remember. Now one of the most important topics, like drug used in the treatment of peptic ulcer as well as inflammatory bowel diseases. Like what are the different types of drugs are there? Like some drugs are there which will reduce the acid secretion. Okay, some drugs are there which will neutralize the acid, nothing but antacid. Some drugs will be there like which will protect the ulcer region, nothing but the mucosal protection. Some drugs are there will be which will inhibit the activity of microbial organism, nothing but the H. pylori. That's it. So acid suppression mechanism action, blocking H plus potassium plus ATPase pump or H2 histamine receptor. Okay, if tidine is there, tidine means H2, INE, IN is there means INE. Okay, if someone will ask, or you if you will face in exam like which is the what is the main mechanism of cimetidine. Okay, cimetidine means tidine is there, then histamine H2 histamine receptor blocking agent. But if prazole is there, omeprazole, pantoprazole, lansoprazole, all of the things are there, prazole means blocking ATP P is there, prazole P is there, that's it. Okay, antacid like neutralization, like sodium hydroxide, magnesium hydroxide, aluminum hydroxide, sodium bicarbonate, all the things. Sodium bicarbonate, systemic antacid, very important. Systemic antacid, sodium bicarbonate. Mucosal protection means it will coat the stomach lining wherever ulcer is there, like sucralfate, bismuth subcitrate, and anti-H. pylori kit like kill H. pylori, prevent the microorganism or destroy the microorganism like amoxicillin, metronidazole antibiotics you have to take. That's it. So these are the things which I have discussed. Please go through these important topics. You may get around 4 to 5 questions, I think. I hope. I think you will get definitely 4 to 5 questions, and hope you guys can attempt those questions properly. Wish you all the best for your PGCET exam. I think hope you guys you will utilize properly last 2 to 3 days, because already exam extended. It will be on 1st June, so you will be having more 3 days. You can utilize this time properly. Please revise and please go through or watch my videos maximum time like 2 or 3 times, so it will be remember for you guys in the during the exam hall also. So once again, thank you guys. Please watch the video till the end. Please like, comment and subscribe, and as well as please share my videos or YouTube channel with your friends, so they also can be benefited, and please tell them to subscribe my YouTube channel. Thank you once again. Please stay tuned.